So I want to make a little video on something I talk about with all my patients, and that is breathing. So we breathe anywhere from 20 to 25,000 times a day. So you can imagine if you do that even a little incorrectly, it can make a pretty large impact on your health. One of the first questions I usually ask is, at nighttime, do you breathe through your mouth or your nose? A lot of people are mouth breathers at night. And so this actually makes a pretty big difference. It can actually create more sleep apnea events, and it can require you to get up to go to the bathroom a lot more. So overall, creating a lot less quality of sleep. And the reason why it impacts your needing to go to the bathroom is because mouth breathing decreases a hormone called vasopressin. Vasopressin is a hormone that actually allows your cells to absorb more water and concentrates the urine in your bladder. And so what happens when you're low in it is you actually can get dehydrated and you need to pee more. And so that is a very common thing that happens for adults. For children, I think is even more important that they breathe through their nose at night, because it can impact their facial structure and development. It also impacts blood flow to the brain. And so the way it does this is because breathing through your nose increases something called nitric oxide. Nitric oxide is a hormone that helps vasodilate your arteries, especially in tiny vessels. So think your hands and your brain, places where there's tiny vessels. And so you can imagine if you have better blood flow to the brain, you're going to think clearer, you're going to do better in school and do all of those things. So these are just a few health impacts of your breath, especially your breath at nighttime. If you tend to breathe through your mouth at night, a pretty easy hack that you can do, and this is actually trending right now on social media, so maybe you've seen this, but you actually just get a little piece of tape, and you just go like this, and you leave the corners of your mouth open in case you cough or you need to talk, because sometimes if you do the entire mouth, it can increase anxiety for some people. The first couple nights that you try to do this, you might only be able to last, a half hour, maybe the next night, an hour. But usually by the third night, you can train your brain, train your muscles, I should say, to actually close your mouth at night and breathe through your nose. If you actually have obstructive airflow because your tonsils might be enlarged, you might need to see somebody first to make sure you actually can breathe through your nose. But for most people, this works fairly well, even people who are really poor sleepers and have pretty intense sleep apnea. So give it a try. It's probably the cheapest thing you can do for your health and can make some of the biggest impact.